Hello, Lisa.
Hello.
Thank you for coming.
You're welcome.
Can you talk a little bit about your profession?
Yes, well, I'm a nurse,
Okay.
and also I teach in nursing, so I'm a little bit of both. I always worked on rehabilitation as a nurse, the neuro department, and I also teach like basic nursing stuff at school, but also specialize in acquired brain injuries. So that's a little bit what I do.
Okay. Where do you teach? In Eindhoven?
Yeah, here around the corner. I don't know
Okay.
if you know the school. If you go to the bus and then
Like
straight
in
ahead.
this direction?
Yeah, it's next to the park here.
Yeah. Okay, I see. Yeah, there's a lake.
Yeah, next to the lake.
Okay.
Yeah, so it's walking distance.
Okay. So you're a nurse. Since like how many times do you?
I'm a nurse for 9 years now, I think, and I teach my third year now. So
30. It's in your university?
no, it's I don't know how it's called in English. The MBO, like the middle.
Okay.
You guys do on the Fontis and
Yeah.
one
The
level
one
lower.
okay.
This
lower,
is
yeah,
where
one
we
lower.
teach.
Okay.
Yeah.
Okay, so you're specialized with neurological patients.
Yes.
We are currently working with some neurological patients as physiotherapists. Yeah, especially Parkinson patient,
And
stroke patient too.
Yeah.
Yeah. So, why did you choose to specialize?
When I was in school, I saw a lot of different departments, and I started on in the hospital on neuro, and I always was really fascinating that they came in really damaged and then sometimes walk out, or you know that nurses who worked there for years said, "Oh well, it's gonna be fine." Like, I don't know if it is, because it was really hard when they come in as a stroke patient or a trauma patient. So it was really fascinating to see that the body can recover with a lot of help actually, but still recover. And then I did a quick search on rehabilitation, and that's my place.
Nice.
Yeah.
And what kind of patient did you see?
Oh, a lot of different patients, because neuro is also dementia, it's also MS, Parkinson's, so a lot of different stuff. But also with injuries, like when a Parkinson's patient is going to fall, it break his leg, and also leg damage, and so it's really broad. A lot of elder people, not young people, so 50 plus.
So neurological, but also musculoskeletal. If they fall, like injury.
Exactly.
Okay. And here in Eindhoven there is a hospital that is specialized in neuro.
Libra Center?
No, Katarina.
Yeah, Libra Center is the rehabilitation
Oh, it's
center.
rehabilitation,
But they also do hearing and sight rehabilitation. Well, we don't have one hospital who's really specialized in it, but we do have. We have 3 hospitals, and every hospital has a neuro department. So it's not one hospital. It's like less neuro.
And are you working on this hospital right now?
No. I'm working on a different, like Libra, different setting, but connected to the hospital.
Okay. Yeah. We know Libra because we went in Tilburg.
Yeah.
With the Libra Center.
Nice. Yeah.
So we like work with patients,
especially amputee.
Mainly amputation.
I did work with amputations a lot too.
Yeah.
And it's the same, almost the same as Libra, but just a little bit different.
Okay. Well, could you explain your role with patients over there when you are working?
Yeah, it's really big, your role as a nurse. It starts with the basic stuff like hygiene and helping to the toilet, but also mentally, and it's a lot of motivational speaking. So it's really everything you do when you wake up until you sleep and wake up again, because when you're asleep you still have to help. So it's really broad. It's also pain management, also teaching new stuff, cope with emotions, teaching how to control emotions with partners as well, or family. So it's
really broad idea.
Yeah, it's also the eating, it's also sleeping, it's everything.
Like all the basic activities like
Yeah.
basic needs,
All the basic
and
needs.
also a lot of support.
It's a lot of
Yeah.
support. Yeah, I think it's more on the neuro that you have to be supportive than when you break it just a leg or just fall from your bike, for example.
Because we're working about collaboration between professions, so we have to identify all the persons that are involved in the treatment. So I imagine that you have experience of collaboration with physio.
Yeah. We always collaboration with physio, but also the ergo. Ergo. The one, the dietist, but also the logo. Is the one who's helping with swallowing.
Oh yeah,
and
logo.
Psychiatrist.
Yeah, of course.
The elderly doctors. So a lot.
Yeah. And how it happened? There is like meeting where you meet all together, or?
It's different because once in rehabilitation you have once a week MDO, a meeting with all the disciplines, and it's about the patient, but all the patients who are staying there, so you go like
Very fast.
Yeah, very fast. But also it's the patient is main, but everybody who's sitting there is one of the disciplines. So I can talk about the patients when in care, but also the physio can talk about how the movements are going. So everybody's own perspective. But we also do not standard, but we did do in the mornings when we do care of the patients. We are really early, so most of the time not everybody is in the house. And after the care we go talk to the physio or doctor or what's going on, so you have a lot of contacts.
Okay. And during this meeting, is there like specific goals? Like, did you discuss about, for example, discharge at home or something like that?
Yeah, the weekly meetings are about the goals. So when a patient comes in care, everybody has to make their goals. So
for the week?
Sometimes for 5, 6 weeks already in school. And then you make smaller goals how to reach it. And it's always like divided in medical goals, physio goals, and care. So what we do as nurses. So can you go to the toilet, for example? And then we discuss how it's going, if they have to do more or less.
Okay, so adjusting the treatment.
Just the treatment, yes.
So for us, we choose specifically stroke patient. Could you tell us about the challenges about stroke patient? What is really difficult with
I think it's starting with when they come into the rehabilitation. It's really the care is really hard because they're really in the beginning of the rehabilitation. So it's more like teaching them to let them see it's not really going well. But sometimes stroke patients have lack of insights in how bad it's going, so they are going to stand up and they cannot even stand up. But it's also teaching them to use the arm who's not working anymore. Also, it's really weird to do it, but when you stimulate the wrong side, it can bring brain pathways again. So it's a lot. They're really emotional, which is understandable. A lot of family contact as well, and really insecure. I don't know if you guys understand what I mean with it. Yeah. So when they wake up in the morning, the day has to start, and not everything is going well. A lot of emotions. Training again. So it's really every day is tough to start again. Until a little bit of the end of the process, it's more happy times than times, but it's a lot.
So it's a lot about education at first, like explaining what's going on.
Yeah. In the beginning, it's a lot of education. Well, and the whole time it's education, but in the beginning it's helping them see that there is something wrong. Because sometimes it's not really. They are not accepting or cannot have the brain, to say to you it's not going well.
Because stroke is very sudden. So
also there, but it depends on where the stroke is. If you see a patient with a stroke more in front, you can see that they're sometimes a little bit more aggressive and hard to talk to, and they don't realize it. So it's really tough to help them realize they had a stroke, for example. they're not doing well. So yeah, but sometimes it's more movement and the emotions are okay. But I see a lot of times that it's more emotion and character changes and how it's going to be in the future than real physical stuff. Yeah.
So you talk a lot about support, and is it mainly you as a nurse, or with the collab with the physio, like the physio is also providing support and information, or it's mainly your role in the rehab center?
I think it's mainly the nurse's role because we see them the most.
Often,
Yeah, and we see them on the most intimate moments. It's different when you go for a therapy and then go away, because we also see them at night when they're waking up and just screaming, or waking up in the morning and are emotional, or the family just left and we're sitting there. So it's more on occasion the support also. So when it's on that time it's necessary.
I had a question, I just forgot it. Yeah, of course, okay.
I just. Yeah, the one.
So with stroke patient, we know that there is multiple phases, different phases, and sometimes they are discharged at home. Usually they want to do it. So, are you going to work in their environment, their home?
Or? No, that's a different type of department as a nurse. I do home care. So yeah, one of the typical things about stroke patients or brain damage patients is when they go out of the hospital to rehabilitation, they have a long process, and then they go home and they still have a long process. So a nurse has to still come to home to help, maybe with medication or other medical stuff. So it's I don't do it, but yeah, it's a long road for a stroke patient. Yeah.
Talking about road, so when the patient comes in the hospital after the stroke, could you explain, like, so he's in the hospital, when does he go to the rehab center, and from there when he's discharged home? Like, how do you discuss that with the multidisciplinary team?
It depends on coming from the hospital. So most of the time it's when the vitals are good, yeah, and staying good for most of the day, 2 days or 3 days. And sometimes they're first on a stroke unit, and then they go to the neuro department. And when they go to the stroke unit, it's really bad. So they're really in a critical phase. If they get out of the critical phase, they go to the normal neuro department in the hospital. They stay for a few days, and then they go really fast to the rehabilitation. So when they don't have any IVs, or when everything is sort of stable, they go over. So it's sometimes days or a week or less. Really fast. Yeah. When they are rehabilitation, it depends on how the home is looking. For example, where you guys come in also, when they have like 2 stories, so bed is on stairs, and they have to walk the stairs, so it's one of the goals the physio makes. But also going to the toilet, and sometimes you see that it's only downstairs